My friend, there's something most men over 60 have never been told. The way you take care of your body in the few minutes after ejaculation is just as important as the act itself. After 60, every ejaculation is not just a release. It's a physiological window where your hormones, circulation, nervous system, and prostate enter their strongest recovery state. But if you skip the 7 important steps right after, your body can slip into fatigue, poor recovery, reduced male strength, and even gradually weaker pelvic circulation over time. I've seen countless men over 60 tell me, "Doctor, I don't feel as strong as I used to, but I don't know why." And when I review their habits, there's one thing almost all of them have in common. They've never been taught what to do after ejaculation to support proper recovery. Today, I want you to clearly understand the 7 simple but crucial things every man over 60 should do after ejaculation to keep hormones stable, boost circulation, and maintain long-term male vitality. And you will be surprised, because these steps aren't complicated at all. With just a few minutes of proper recovery, your body responds very clearly. I'm Dr. Emily Carter, a board-certified urologist with over 14 years of experience working with men over 50 across the United States. Over the years, I've realized something very important. Older men don't decline just because of age. They decline because their bodies no longer respond the way they did at 20 or 30. Old habits, old routines, and old assumptions, none of them fit this stage of life anymore. What troubles me most is that most men don't know this. They quietly worry when they feel more tired after ejaculation or when it takes longer to regain their energy. But they don't talk about it. They don't know who to ask. And they certainly don't know that with a few small adjustments, their body can still maintain sexual strength, circulation, and confidence for many years. That is exactly why I'm making this video, not to judge or criticize, but to help you finally understand your own body, to understand what actually happens after ejaculation at age 60 plus, and the simple steps that help you recover faster, sleep deeper, and wake up energized the next morning. Men's health is not just testosterone. It's not just erections or pleasure. It's confidence, mindset, and the feeling of being in control of your own body. And I believe that when you care for yourself properly, everything changes. Before we dive into the 7 most important things men over 60 should do after ejaculation, I want to hear directly from you. This helps me tailor future videos to your age, health, and lifestyle. So if you don't mind, how old are you? And where are you watching this video from? Which state in the U.S. or which country? Leave me a quick comment below. I read almost every comment men leave, and every piece of information helps me create more accurate and useful content for men in their 50 seconds, 60 seconds, 70 seconds, and beyond. Don't hesitate. Our community is a place where grown men can learn, improve, and upgrade their health without shame or judgment. And now, if you're ready, let's move into the most important part. What actually happens inside your body after ejaculation at age 60 plus? To understand why the 7 steps I'm about to share matter so much, we need to look at what's really happening inside your body immediately after ejaculation, especially at your age. After orgasm, the body enters what medical science calls the recovery phase. At a younger age, it's quick and effortless. But after 60, your body needs more time and support to return to balance. First, the prostate has just contracted powerfully to release semen. This makes the pelvic area temporarily tense and sensitive. If you don't relax it properly, the pelvic floor can hold on to that tension, leading to mild discomfort, pressure, or weaker urine flow later. Second, dopamine drops after orgasm, which is why many men feel slightly sleepy or a little down afterward. But after 60, dopamine rebounds more slowly, making you more prone to fatigue or low motivation if you don't support recovery properly. Third, oxytocin and prolactin rise, 2 hormones that promote relaxation and help your nervous system reset. This is a golden window to sleep deeper, reduce stress, and restore energy if you take advantage of it. And finally, pelvic blood vessels are dilated to support circulation. If you stand up too quickly, make sudden movements, or start doing physical tasks, The rapid shift in blood flow can make you dizzy, tired, or lower your vitality afterward. In other words, after ejaculation, your body enters a powerful recovery mode, but it's also very easy to disrupt if you're not careful. Once you understand this, the 7 things you should do afterward are no longer just tips. They become the foundation for protecting your hormones, your circulation, and your male strength as you move through your 60 seconds and beyond. My friend, the very first thing, and the thing most men completely overlook, is giving your body an extra 2 to 3 minutes to stay in its natural relaxation state after ejaculation. It sounds small, but for a man over 60, this is one of the moments that determines how well your hormones, nervous system, and circulation recover for the rest of the day or night. Right after orgasm, your nervous system goes through a very subtle shift from a highly stimulated state into a deep recovery state. This is controlled by the parasympathetic system, the part of your body responsible for calming you down, stabilizing your heart rate, relaxing your blood vessels, and bringing your hormones back into balance. During this time, your body releases oxytocin and endorphins, 2 hormones that act like natural relaxation medicine. They reduce stress, soothe your blood vessels, relieve pressure on the prostate after its contractions, and prepare your body for deeper sleep if this happens at night. But here is the problem. Most men unintentionally break this golden recovery window. I've met so many men over 60 who tell me, "Doctor, once I'm done, I get up immediately. It's just a habit." They think, "It's over, so let me go do something else." Or, "There's no reason to stay lying down." But what they don't realize is that this tiny action is enough to reactivate cortisol, the stress hormone pulling the body out of recovery instantly. And when cortisol rises, several things happen. Blood vessels constrict, heart rate increases, the nervous system switches back into alert mode, and all the physiological recovery benefits you were supposed to get almost disappear. This is why many men feel tired, tense, or emptied out after ejaculation, not because of age, but because they didn't give their body enough time to recover properly. So after you ejaculate, I want you to stay still, relax your shoulders, place one hand on your belly to slow your breathing, and let your body recalibrate during these precious 2-3 minutes. Think of this as a small gift you give to your body. You will feel the difference clearly. Faster recovery, deeper relaxation, and a renewed sense of vitality the next morning. This is a small step, but it is the foundation for everything that comes next. Step 2. Rehydrate your body immediately. The next thing you should do after ejaculation is rehydrate right away, ideally with warm water or a small amount of a light electrolyte if you feel slightly drained. Many men don't realize that ejaculation, especially after 60, causes the body to lose some fluids and minerals through semen, mild sweating, and pelvic contractions. After orgasm, prolactin rises, which can make your body dip for a moment. Some men may even feel slight dizziness, momentary fatigue, sudden sleepiness, or a feeling of being low on energy. Warm water plays an especially important role because it can gently dilate your blood vessels, supporting pelvic circulation when your body needs it most. Stabilize blood pressure, lowering the risk of dizziness when you stand up. Soothe the nervous system by activating the parasympathetic response. If you have a no-sugar, no-caffeine electrolyte packet, you can mix a small amount. Electrolytes help your body quickly rebalance essential minerals like sodium, potassium, magnesium, all of which are critical for your nervous system and muscles, especially the pelvic floor. I often tell my patients, after 60, the smallest things are often the things your body needs the most. One sip of warm water after ejaculation may sound simple, but it can prevent headaches, reduce fatigue, relieve that heavy, sluggish feeling, reset your body and mind, and prepare you perfectly for the next steps, like deep breathing or pelvic relaxation. Many of my patients say that just adding this one habit makes them feel lighter, more grounded, and far less tired. The body of a man over 60 is incredibly intelligent. Give it what it needs at the right moment, and it will repay you with strength, resilience, and calm. A simple step, but a powerful start to natural physiological recovery. Step 3. Do 6 nitric oxide breaths. The third thing I want you to do after ejaculation is 6 rounds of nitric oxide breathing. A simple yet powerful breathing technique that boosts blood flow instantly, especially in the pelvic area and legs. After orgasm, your blood vessels are already mildly dilated. This is the perfect moment to increase nitric oxide, the molecule responsible for expanding blood vessels, reducing pressure on the prostate, and improving overall circulation. Here is how to do it. Inhale through your nose for 4 seconds. Hold for 1 second. Exhale through your nose for 6 seconds. Repeat this 6 times. Keep your shoulders relaxed, your belly soft, and feel the airflow moving into your lower abdomen. Just a few breaths like this, and you'll feel your body cool down, your mind ease, and your blood flow smooth out. For men over 60, this is the key to reducing post-ejaculation fatigue, supporting hormone recovery, and helping your body transition naturally into deep sleep if you do this at night. This technique isn't just good for sexual health, it's also powerful for your heart, brain, and stress regulation. All crucial as we enter our 60 seconds and beyond. The next thing you should do after ejaculation, and this is a step most men have never been told, is to release tension in the pelvic floor by gently activating those muscles in a relax, light squeeze, release pattern. The pelvic floor is the foundation that supports your prostate, bladder, rectum, and the entire male sexual system. During ejaculation, this muscle group contracts powerfully to push semen out. After age 60, these contractions often leave behind residual tightness, causing the pelvic area to stay tense instead of relaxing fully. When the pelvic floor remains tight for too long, you may experience a weak urine stream or post-void dribbling, a heavy or tight sensation in the perineum, reduced sexual sensation, poor circulation in the genital area, or a dull ache without any obvious cause. To fix this, use the following simple technique. Inhale gently and completely relax the pelvic floor, similar to the feeling when you're about to urinate. Lightly contract those muscles for 2-3 seconds, as if you're trying to stop the urine flow. Exhale and release all the tension. Repeat 4-5 times. The goal is not to squeeze hard, but to return the muscle group to a balanced state after working at high intensity during ejaculation. Many of my patients say that when they practice this technique, the heaviness in the pelvic area reduces noticeably. Their morning urine stream becomes stronger, and circulation improves the following day. It's a small step, but it plays a major role in protecting prostate health and supporting nervous system recovery in the pelvic region, something men over 60 need more than ever. Step 5. Avoid all stress or stimulation for the first 10 minutes. The fifth thing you should do after ejaculation, and I want to emphasize how extremely important this is to avoid any form of stress or strong stimulation for the first 10 minutes. Here is why. Right after orgasm, your body enters its natural recovery phase. Your parasympathetic nervous system is working hard to relax blood vessels, calm the pelvic muscles, and bring your hormones back into balance. But just one strong stimulus, like getting up suddenly, checking your phone with bright blue light, engaging in arguments or emotional stress, doing physical work or walking quickly, or continuing excessive sexual stimulation, will instantly switch your body into alert mode. Cortisol rises, heart rate increases, and the entire physiological recovery process gets disrupted. I see this all the time in older men. They reach orgasm, and just a few seconds later, they stand up, check their email, or go straight to another task. The result? They feel prolonged fatigue, sleep poorly at night, lose energy, or feel emotionally empty afterward. That's why I recommend give your body 10 golden minutes to recover hormones and circulation. Lie down or lean back gently, breathe slowly, and don't rush into anything. When you honor this recovery window, your body rewards you with clarity, faster healing, and a stronger sense of masculine vitality the next day. Sometimes, the best thing you can do for your body is to do nothing at all. My friend, once we cross 60, the body simply doesn't operate the way it used to. Every shift in hormones, circulation, or nervous system activity becomes more noticeable, and that's why these small steps after ejaculation have such a powerful impact on your overall health. In just a few short minutes, your body transitions from stimulation to recovery. Your prostate is relaxing after strong contractions. Your pelvic blood vessels are widening to improve circulation. Your parasympathetic nervous system is trying to bring you back into a calm, healing state. If you support your body properly, this becomes a natural medicine that improves your sleep, reduces stress, restores hormones, and enhances long-term male vitality. That is why the first 5 steps I shared, staying relaxed, hydrating, nitric oxide breathing, pelvic floor release, and avoiding stress, are simple but essential tools that help your body recover correctly after each orgasm. When you honor this recovery phase, you're not just protecting your prostate and circulation, you're protecting your life force, your confidence, and your masculine presence. And the best part is, these positive changes come quickly as soon as you give your body the chance. Now, let's move to the final 2 steps that complete your post-ejaculation recovery ritual. These are the habits that help you maintain long-term strength, prevent fatigue, and protect your pelvic nerves and blood vessels. Step 6. Always use gentle pressure. After age 60, the body's natural sensitivity decreases. Because of this, many men try to compensate by using more force, gripping tighter, or stimulating more aggressively to reach climax. But this is exactly what damages the delicate nerves of the penis. When you use excessive pressure, the skin and soft tissues can suffer micro-injuries, leading to scarring or reduced elasticity over time. Remember this: your body responds far better to gentleness than to intensity. When you treat your body with subtlety and precision, it rewards you with deeper, more natural, and more sustainable sensation. Step 7. Maintain emotional connection and presence. A common mistake for older men is just getting it done, forgetting that pleasure is not just a physical reaction. When you disconnect from your emotions, your breathing, and your mental state, your body doesn't release enough oxytocin, the hormone that calms the nervous system and creates a sense of warmth and fulfillment. Think of this moment as a self-care ritual. Breathe slowly, feel your body, and treat this as a time to appreciate the vitality that still lives within you. Whether you're 60, 70, or beyond. When you connect with your body through presence and gratitude, the recovery process becomes entirely different, deeper, more complete, and far more satisfying. My friend, the practices I've shared today are not abstract theories. They are small habits that can transform your sexual health and overall quality of life in ways medication alone cannot. When you understand your body and support it properly, you will feel a noticeable difference: deeper sleep, faster recovery, and a stronger sense of confidence in yourself. If this information brought value to you, hit subscribe to Senior Men Health Secrets. Turn on notifications so you won't miss upcoming videos on circulation, prostate health, testosterone, and male strength after 60. We still have many important things to talk about, and I want to walk with you on your journey to restoring your energy, resilience, and vitality. Before we finish, let me remind you of something essential. The information in this video is based on scientific evidence, clinical experience, and real-world observations from working with thousands of men over 50. However, this video is not a substitute for medical diagnosis, consultation, or treatment. Every body is different. If you have underlying conditions, are taking medication, or are experiencing unusual symptoms such as persistent pelvic pain, difficulty urinating, loss of sensation, or sudden erectile dysfunction, please speak with your healthcare provider for personalized guidance. This video is designed to help you understand your body better and make smarter decisions for your long-term health. See it as a trusted source of information, but always combine it with proper medical care when needed. Your body deserves the right kind of attention, and I hope today's insights become a foundation for a healthier, stronger, more confident life ahead. My friend, men's health after 60 is not a downward journey. It's a journey of understanding your body more deeply and caring for it more intelligently. When you apply the right steps after each ejaculation, your body recovers more powerfully, your circulation improves, and your spirit becomes stronger. Before you leave this video, I want to hear from you. Of the 7 steps I shared, which one do you feel you need to change the most? Leave a comment below. Your experience could help many other men who are in the same stage of life. If you found this video helpful, please like, subscribe, and share it with someone who may need this information. I'm Dr. Emily Carter, and I'll see you in the next video. Remember, age doesn't take away your masculinity, not when you know how to reclaim it.